Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 1. Shock. Prompt intervention in the early stages of shock may prevent the decline to the progressive or irreversible stage. General management strategies begin with ensuring that the patient has a patent airway through oxygenation and ventilation, followed by fluid resuscitation for volume expansion and drug therapy that has a primary goal to correct tissue perfusion. Fluid therapy. Fluid types used in the management of shock are as follows: crystalloids, blood products, and colloids. Crystalloids. An example is isotonic solutions such as 0.9% sodium chloride or NSS and lactated ringers LRS. This type of fluid primarily remains in the intravascular space, increasing intravascular volume, and used for initial volume replacement in most types of shock. You should monitor patient closely for circulatory overload, and do not use LRS in patients with liver failure. LRS may be used if hyperchloremic acidosis develops from use of NSS in fluid resuscitation. Another example of crystalloids is hypertonic solutions such as 1.8%, 3%, 5% sodium chloride solutions. This fluid remains in the intravascular space, increases serum osmolarity, shifts fluid volume from intracellular space to extracellular space to intravascular space, and may be used for initial volume expansion in hypovolemic shock. You should monitor patient closely for signs of hyponatremia, for instance, disorientation, convulsions. Central line preferred for infusing saline solutions greater than or equal to 3%, since these may damage veins. Next fluid are blood products, such as packed red blood cells, which replaces blood loss, increases oxygen carrying capability, fresh frozen plasma, which replaces coagulation factors, and platelets, that helps control bleeding caused by thrombocytopenia. These are being utilized in all types of shock. Nursing implications is the same precautions as any blood administration. Next fluid is colloids. An example of colloid is 5% or 25% human serum albumin, which can increase plasma colloid osmotic pressure for rapid volume expansion. And this is used in all types of shock, except cardiogenic and neurogenic shock. And take note of this one. Use 5% solution in hypovolemic patients. Use 25% solution in patients with fluid and sodium restrictions. And lastly, last example of a colloid solution is dextran, which acts as hyperosmotic glucose polymer. But this is in limited use because of side effects, including reducing platelet adhesion and diluting clotting factors. Nursing implications are the following: monitor for circulatory overload, mild side effects of chills, fever, and urticaria may develop. Limited use because of side effects, including reducing platelet adhesion and diluting clotting factors. Increases risk of bleeding. Important to monitor patient for allergic reactions and acute renal failure. And this fluid is more expensive than crystalloids. Kindly click the next button for part 7. Thank you for listening. Have a good day and be safe. Agyamanag.